What is up, Sono peeps? Welcome back to my channel. In this week's video, we're going to be looking at some ultrasound scenes in Chicago Med. Never seen it before, so let's get right into it. This isn't about you guys this week. We can take a break from judging you guys and we will pick back up whenever we do. Alright, first video. Wait a minute. First of all, it's just the way he squirts the gel on there. So usually in trauma cases, it looks like here it says it was a train crash. They're gonna order a fast exam with ultrasound. So that's gonna be right upper, right lower quadrants, and then left upper, left lower quadrants, just to make sure that there's no internal bleeding or blood kind of pooling into the sides. So a fast exam is gonna be what's ordered for that, typically. And it just looks like he's doing that, but just the way he's scanning like this, I will give him the benefit of the doubt because it looks like he has a whole bunch of people around him. He's just trying to get the work done, but it's just the way he's scanning like this. We sonographers are notorious for injuring ourselves on the job, and this just seems like the quickest way to get a wrist injury if you do it enough.
No gag reflex, didn't even need sedation. Not good.
We got another problem. This woman's pregnant.
Okay, so it looks like he has some kind of pulse Doppler on the baby, like real fast. I mentioned this in my Grey's Anatomy video. As soon as you put the probe down, pulse Doppler is not on. You shouldn't hear a heartbeat. You shouldn't hear any type of pulse. It's literally just in what we call B mode. And B mode is just grayscale, black and white. You're just seeing what's there. To be able to hear heartbeats or pulses or anything like that, you'd have to hit a button that says pulse Doppler and put the little, we call it a, I forgot what it's called. Just put that focus on where you're looking at. So right there, it just says profile, which I don't know why they even labeled it right there, but I don't see any profile. I just see the baby moving around, and it looks like that line for the pulse Doppler is right where the heart should be. But again, since the baby's moving around, which doesn't happen either. Usually when you focus on something on pulse Doppler, it's gonna stay there and you're just gonna see the waveform, but you don't see any of that either. It looks like the baby's big enough where, okay, they teach us in ultrasound school, do not use pulse Doppler on fetuses. I've seen places that do. I don't know the reasoning for it. Usually we use M mode. This does not seem like they're using M mode, first of all. Second of all, it's not even on the heart, which is what would be giving that sound. Just all around, I just don't see what's going on here.
There.
Okay, there now it seems like he's more relaxed. He's scanning left-handed while he's on the patient's left side, which again, at least where I work, does not happen. He's got the screen turned, so I guess the patient is looking at it too. Again, the pulse Doppler is still on there. It still says profile. I feel like it's just the same screen and it's just a different scene that they're showing it on.
You can see her feet and a hand. Everything looks good, Mr. Macedonian.
Oh, thank you for doing this. We just needed to see her again.
She just squeezed my hand. I swear, I felt it.
Her reflexes are still intact. Movement can occur, but it's not purposeful.
She just did it again right when you wiped her stomach.
The way he's using a little tissue to wipe the gel off, which I didn't even see any gel on her. I don't know, I just found that funny. Let me see if there's any other ultrasound in this video. Doesn't seem like there is, so we're gonna move on to the next one.
Mr. and Mrs. Harris, I'm student Dr. Curry, and this is Dr. Manning.
And Lisa.
Matt.
So, you're 13 weeks pregnant with 3 days of abdominal pain. Have you ever had pain like this before?
No.
I'm going to examine you. That's all right. Okay, have you had any bleeding?
No.
Okay, any complications with your pregnancy?
No. I mean, not with the pregnancy.
For years, doctors said Lisa could never get pregnant. We tried and we prayed, but nothing worked. Until one day, it just happened.
Did they tell you why you couldn't get pregnant?
Something about the shape of my uterus. They did some tests, but whatever it is, it doesn't matter because we finally have our miracle baby.
So that she said the shape of her uterus, what she means is how the uterus is flexed. There are 4 different ways that a uterus can be positioned. There's anteverted, anteflexed, retroverted, and retroflexed. Anteverted is basically where the uterus is tilting forward per se, and retroverted is basically where it's tilting backward. And I'm just trying to use lay terms. And then anteflex or retroflex is either or, forward or backwards, but it's basically flexed all the way to where the fundus meets the cervix. And they do say that certain ways your uterus is positioned can make it hard to hold and maintain a pregnancy. So this is probably what they mean there.
So the thing about human anatomy is that even when things may seem like a miracle, they're
No, before we get much further, I think we should check your blood and send you over for a Doppler, just to get some more information. Is that okay?
Yeah, it's okay.
Great. We'll be back soon.
There are doctors that are more compassionate than others. There are some doctors that are very matter of fact and saying like, there's no way this is a miracle. There's some kind of explanation for this. I don't like those type of doctors.
First trimester pain in a woman with anatomic abnormalities means that this pregnancy could be ectopic.
Yes, but that does not mean that we need to give her a physiology lesson.
We do if we want her to be informed about her condition.
She's entitled to her beliefs. It is not our job to challenge them.
It is when they're wrong.
Miss Curry, we don't know what we're looking at yet, so just go order the tests.
Is that the baby?
Yes.
It's something about the way her arm is all the way outstretched just to do this exam while everyone is like cramped up in the room looking. It does seem like the screen is moving according to how she's moving. That's pretty peculiar because usually in shows like these they have like a pre-recorded screen on there and then they just kind of, you know, fake it till you make it. It seems to be on one side, like more like scanning her adnexa, and then she's like tilted over, and she's pretty high up for it to be at 13 weeks. If she's in her first trimester, the baby would still be within like below the umbilicus, so like under the belly button, pretty low in the pelvis. At least that's where I've seen most first trimesters. Even if it is a 13-weeker, I wouldn't expect the pregnancy to be all the way to her right side next to her belly button, you know what I'm saying? But again, she's like at a weird angle, so I feel like she's just trying to get what she can get, and yeah.
Your pregnancy is ectopic, which means that the fetus is...
Okay, I spoke too soon. It's an ectopic. Maybe I should like give it a second before I start saying. So ectopic in the right side, most likely in an ovary, but 13 weeks?
Planted outside of your uterus.
Okay, but you can put it back where it belongs, right?
Unfortunately, we can't.
And I'm afraid it's implanted on your vena cava, the large vessel that carries blood back to your heart. And from the free fluid I'm seeing in your abdomen, tells me that unfortunately the vessel is leaking.
So how do you stop it?
You need an operation. The surgeon will have to remove the fetus and then repair the vessel.
Wait, you mean we could lose the baby?
I'm sorry, but you would in any case, because of where it's implanted, there's no possible way that it'll survive long enough to be viable.
And surgery will keep your bleeding from getting out of control. So we need to get you up to the OR as soon as possible.
No,
I'm sorry?
I'm not having surgery.
I don't think you understand. If we don't operate, you're going to die.
No, you don't understand. This baby is a miracle, and God will take care of it.
If you know me, you know I am all about my faith. This is pretty crazy. Something about that doctor, I don't know. I don't know if I like her. I don't watch Chicago MD, so I'm keeping an eye on her though. I've never seen an instance where an ectopic pregnancy is in the vena cava. So the vena cava is basically the large vein that runs on your right side next to your aorta. And I just never ever seen a case of an ectopic. Probably has happened because they're showing it here. Just the fact that she made it to 13 weeks without it ever being found. Did she not have prenatal care? She should have found that within the first couple weeks, where they see that HCGs are coming up, but there's no gestational sac within the uterus. You know, kind of want to see how this ends. I'm gonna have to watch that later though.
Julia Dutra, 34, pregnant, para 1, gravida 0.
Para 1, gravida 0. Okay, first of all, it's gravida 1, para 0. From what I was taught, gravida means how many times you've been pregnant, and then para means how many live births you had. So in this case, it would be her first pregnancy. So it would be gravida 1 because it is one pregnancy, and then para 0 because she hasn't had the baby yet. In the case where you were pregnant one time and had the baby one time, it would be gravida 1, para 1. Now, if you've had like spontaneous abortions or intentional abortions, it would be, let's say, like gravida 1, one pregnancy, para 0 because you didn't have the live birth, and then abortion 1. Yeah, just a little mix up there that I had to point out.
Fainted in a yoga class. An AFib at 150, BP 90/60.
Hi, Julie. I'm Dr. Manning. This is Dr. Halstead. I told him I don't want to be here.
Hopefully this won't take long. On my count. 1, 2, 3.
Julie, are you okay?
I'm fine. Just call Mira.
Our midwife. I think Julie would be more comfortable at home with her.
Sir, your wife's in a dangerous arrhythmia. We can't let her go till we get under control.
Do you have any history of heart disease?
No, I don't eat red meat, and I keep a high antioxidant profile to minimize inflammation.
Okay, good. Let's get an EKG, cardiac lab, CBC, CMP, coags in a UA, and let's start 5 of Rapamil IV, okay?
No medications.
This one's safe for pregnancy.
If we don't control your arrhythmia, it could put the baby in danger.
Is that true?
Scott.
What? We don't want anything bad to happen.
Okay, fine, but then we're leaving.
Thank you. All right, let me ask you a few more questions.
Wait, what are you doing?
Just a quick fetal ultrasound.
No, get that thing off me.
Acoustic radiation impairs neurodevelopment.
That's not actually.
It's really hard to see, but it looks like I'm trying to just. Can I zoom in on this? I can. Okay. That almost looks like, I want to say, a sector width, which is basically like the shape of the actual image. Makes it look like he's using a linear probe, which is like a flat probe with virtual convex, so it's basically like, let's call it wide angle. And I want to say, it looks like kind of blurry, but it looks like it's a transvaginal view of what he's looking at.
Note that the fetus measures normal size and weight for 5 months.
Fetus measures normal size and weight for 5 months. How does he know that? I didn't see him take any measurements. He could maybe say it looks like a 5-monther. He didn't take any measurements. He didn't take any head circumference, BPD, abdomen circumference, no femur length, nothing. How do you know how much it weighs? I digress.
Wait, what did you say?
That this looks like a normal 5-month pregnancy.
Measure it again.
I'm sure of the numbers.
Well, you're wrong. Measure it again.
See? Totally normal for 5 months.
Except I'm not 5 months pregnant. I'm 8.
So I like how he says, like, oh yeah, I'm sure. Did a sweep, look, 5-month baby. Which it did look like a 5-month fetus, but I like how she says measure it again, and he's like, look. And then just, I don't know.
All the signs of early kidney failure.
No family history of troubled pregnancies or genetic conditions.
Maybe a malabsorption syndrome?
Miss Dutra, have you ever had any gastrointestinal issues, Crohn's, ulcerative colitis?
I used to have leaky gut. At first, we thought it was just lactose, but of course, it was more complicated than that.
Okay.
I see. And were you seeing someone for this?
My nutritionist, she got me off lecithin and phytic acid. It helped some, but then once I got pregnant, I had to give up all GMOs and anything that wasn't locally sourced too.
So what do you eat?
Certain strains of Swiss chard, broccoli. Sometimes I'll have a cup of Itsuki beans.
But she supplements a lot. Selenium, coenzyme Q.
Do you eat 3 meals a day? More? Less?
I do portion control to manage the baby's glucose. 700 to 800 calories a day. Why?
Basically, she's one of those people that don't trust in medicine or anything that may be artificially enhanced, probably like very organic. I don't know much about that, but that is all on the ultrasound portion. I didn't see much of what he was doing or looking at, but I do know for a fact that he did not measure anything. It looks like he played it by eye. I was gonna say play it by ear, but definitely just looked and said, yep, 5 months. So I don't know, there's not much to say on that one. Show looks interesting. I might have to invest time, but I'm not even caught up on Grey's Anatomy yet, so yeah. Alright, you guys, those were some ultrasound scenes in Chicago Med. That was definitely interesting. I didn't get to see much of that last one. Comment down below if I missed anything that you might have picked up on in these ultrasound scenes, and comment down below your favorite medical drama that I should look into next. As always, you guys, like, comment, subscribe. Know that you are beautiful, blessed, and loved, and I will see you guys in the next one. Bye.